Hi, I'm Dr. Erin O'Brien, one of the rhinologists at Mayo Clinic Rochester and Division Chair for Rhinology in the Department of Otolaryngology Head and Neck Surgery.
Hi, my name is Rohit Divekar. I'm a consultant in allergic diseases and the chair of research in the Division of Allergy and the director of the clinical lab in allergy at Mayo Clinic in Rochester.
Dr. Divekar and I wanted to spend a couple minutes talking to you about what you could expect in coming to Mayo Clinic Rochester if you have chronic rhinosinusitis. He and I collaborate in clinic and in research in understanding the disease of chronic rhinosinusitis and the other diseases that go along with it. Dr. Divekar, do you want to talk about how we manage patients together?
Yeah, I think the biggest asset we have when we see patients together is this wealth of knowledge that we share, both from a surgical perspective as far as the medical management is concerned. There is a clear understanding that sinus disease, even though it is lumped together as one, is really many diseases that have different causes and can present similarly but have different evolutions. So finding the right kind of disease allows us to find the best medications and the treatments that we can offer them, and this greatly improves the outcomes.
We often see patients together. We coordinate appointments, and so do our colleagues in the rhinology division and ENT, and then in the allergy division. There's a lot of diseases that overlap. So as a rhinologist, I deal with the nasal side, the chronic rhinosinusitis, and the nasal polyps. And the allergists also manage a lot of the other co-diseases that come with it.
Right. So you could have inflammation of the sinuses that could be from genetic causes. It could be from deficiency of the immune system. It could be inflammation of the sinuses in association with inflammation elsewhere, like autoimmune conditions, or even something as common as asthma. So as a internist trained in medicine, having that team on board who is able to diagnose some of these conditions properly and then find the right tools and therapies really enhances a surgeon's contribution as well, because ultimately we're looking at the patient from a holistic perspective and not just one organ as is.
A lot of times I'll see patients who've maybe had surgery elsewhere and then their symptoms come back. And what we found is when we work together, you and I and our colleagues, we're able to not only have a surgical plan, but also a medical plan. Also, sometimes they might not even need surgery. And I agree, it's important that we work together to figure out if there's other medical options that we need to talk about and look at the whole patient. When a patient wants to come to Mayo Clinic, what options do they have for that sort of initial contact, that initial entry into Mayo Clinic?
So one option could be that if they were to approach your clinic, then based upon their responses, if they are found to be suitable to see us, and most of them do end up seeing us, we could set up a video visit beforehand to collect as much information to make their trip down here as efficient as possible. Because we understand that people who come here, they travel long distances, they have few days to get everything taken care of so that they can arrive at some answers that they are seeking. And that kind of pre-visit planning allows us to really triage and plan for your stay here in the most efficient manner. So by the time you leave Mayo Clinic, we have exactly the plan as to what is to be done, when, and how we are going to implement it.
When someone comes to see me in the ENT department in rhinology, it's always important that we have old CT scans as well as most recent CT scans. If they don't have something recent, we will get a scan here because we want to see the process of their disease, how long it's been going on, what's been done before. What kind of tests and lab work are going to be important when they see you?
Yeah, so thanks for bringing up that question, Erin. So one of the crucial contributions that this collaboration brings to patient care is the ability to use the diagnostic tests that are available at Mayo, including the allergy lab that we have here on our floor. And there we could diagnose allergic sensitivities, we could diagnose mold allergies, we can diagnose things like, do they have asthma? We could do tests to confirm those diagnoses. And even for some of the now better understood and more prevailing conditions, especially in the media, aspirin exacerbated respiratory disease being one of them, there is a greater understanding of that condition. We are able to do challenges for diagnosis and even desensitization in our lab. So it's a very good way to leverage the tools we have as a subspecialty to assist taking care of patients. And these are the conditions that we both share.
And speaking of this aspirin exacerbated respiratory disease, or AERD, we have a lab that we can run here that can help us to help make that diagnosis. Do you want to talk a little bit about that?
Yeah, so we've had some good success with patients who have AERD, and especially with the lab that Dr. O'Brien is talking about, that's a urine test called leukotriene E4. There is plenty of research done elsewhere that shows that this is a marker of the disease state that leads to the development of AERD. And one of the advantages of this accurate characterization, it really opens up the possibilities that we can offer to the patient, both diagnostics as well as therapy-wise, because there are certain medications that can specifically target this pathway and that can overall help with the outcome on these patients.
And I'll echo too that we, because of this collaboration, a lot of patients appreciate they're going to see someone from each division when they come and leave with a plan. Sometimes that includes surgery, and you and I usually coordinate what medication to start first, then decide if someone needs surgery. So they may need to come back if surgery is an option. But even more important is the follow-up. Surgery by itself is not the cure. They need additional treatment, and that's where having your input at the beginning, even before surgery, can really be helpful.
Absolutely. And, in talking to the patient, when they go through this process, they realize that surgeon is an important part of this team, because unless and until the disease is taken out, the medications may not have that much of an effectiveness. But surgery is not curative, because if they don't do medications, then the disease is going to come back. So it's a really synergistic relationship that allows us to take care of the patient and what's best for them.
The other thing we find too is that a lot of their other symptoms, like their asthma symptoms, may get better with management of their sinuses. So that's how we work together also. If you see someone with really bad asthma and then it turns out they have sinus disease,
right,
then we get involved and we collaborate through the whole airway.
Absolutely. And honestly, Erin, I think the greatest strength that Mayo has is not just collaboration within some limited divisions, but collaboration across divisions. So if we find that somebody else has another lung condition that overlaps with sinusitis and asthma, then we have some very talented pulmonology colleagues who can help us with that. Or we can engage with neurology for taking care of some comorbid or associated migraine or headache disorders that are often found in this disease.
Also rheumatology for some of the rheumatologic diseases
Right.
that we find.
Absolutely.
I agree. The benefit of working here is all of the departments are right here on site.
Right. And I often tell my patients that the reason I like working here is you can get a lot done in a few days that elsewhere might take months to accomplish.
And the benefit now of being able to do video visits, as you said, is we can help get those things set up before someone comes to Rochester, Minnesota.
Right.
Great. Well, I appreciate your time today talking about how you and I manage patients with chronic rhinosinusitis, how the collaboration helps patients leave Mayo Clinic with a plan and improves more than just their sinus disease, but also their whole airway disease.
Thank you, Erin, for having me.
Thank you.